Diet's going to be one of the hugest things that people can make a change in. Processed foods, refined sugar, processed meats, those are not natural foods, and those are things that come with a lot of chemicals inside of them, a lot of contaminants. We know that processed meats, for example, type 1 carcinogens, all these sugars have a direct correlation with somebody's ability to get pregnant. When it comes to the direct cause, it's usually going to be sperm quality or egg quality, depending on the study looked at.
What about red meat?
Oh, I love that question. Number one, I think it's really important that nutritional studies, people qualify meat differently. So it might be all meat, it might be types of meat. So we have to take it in perspective of the limitation of the data. We know that processed meats impact fertility. We know that red meats appear to impact both sperm production and egg and embryo quality. There was an IVF study done, and the more servings of red meat you had in a week, the less embryos you had developed throughout the process than somebody who had fewer servings. So that's telling us that it's maybe not one red meat in general is bad, one serving, but it's about the amount, right? Everything in moderation, nothing in excess. We know that the healthiest fertility diet, high in fruits and vegetables. Fruits and vegetables are fiber sources, they are antioxidants, they are helping our body function appropriately, they're helping our gut function, they are lowering inflammation. I say meat is okay. I don't eat meat, but that doesn't mean that none of my patients should eat meat. I give them this diet because I think you have to make dietary change accessible. If I told everybody stop eating meat, nobody's going to listen to anything. But we know that it's the amount, the quantity. So I say if you're going to eat an omnivore diet, which is going to be the majority of people, have a meatless Monday. Meatless Monday, you automatically can do, and you're going to have to substitute in some of those other sources of protein that are ultimately better for you.
Fish?
Fish is great. We should limit fish to 3 times per week just due to risk of mercury, but fish is a wonderful option. It does have a lot of good omega-3 fatty acids in it, and ultimately eating more fish and less red meat is such a great substitute.
What about skimmed milk and fertility? I've heard you speak a little bit about that in the past.
So what's interesting, and I think that we've grown up in this, fat-obsessed culture that has prioritized low-fat, no-fat foods. And number one, fat is important in the production of steroid hormones. Estrogen, progesterone, testosterone are steroid hormones, so they need cholesterol. The source of that cholesterol is important. So we should have those healthy fats, the nuts, the avocados, the oils. Fantastic. Healthy fats are wonderful. But when it comes to dairy, we've seen that whole fat dairy is associated with better fertility, better ovulation than the skim dairy products, probably due to the processing. If we view skim milk as the processed version, if I'm going to take out the fat that normally comes in the milk, but still want it to retain looking like milk, it's not just minus fat, right? It's minus fat plus something else. So in the production process, it's that, or it's potentially that the only benefit the dairy really has is being a source of a healthy fat option, and that when you take out that fat, you lose that. So I recommend that if you consume dairy, and that you stick with the whole fat versions, you don't do skim or low fat, and in moderation for dairy consumption. I say that if you do meatless Monday, the rest of your meals for the week, you should have 1 serving of meat per day. That's going to make you, just force you to eat more fruits and vegetables. And then one of those meals, you should have red meat if you like red meat, not multiple times a week. And then you should limit processed foods, sugars, processed meats, all those refined carbohydrates, all the packaged things that are totally fake. That should be very rare. Those are your occasion type of foods, not your everyday foods.
So say I'm starting out in life with a full ovarian reserve, or say, here's my ovarian reserve at, say, 20 years old. If I start engaging in unhealthy lifestyle choices, if I start eating processed food, if I become obese, etc., does that take marbles out of this jar? Does that take eggs out of my reserve? Or does that just damage the quality of the eggs in the jar?
Both.
Both, okay. So it pulls them out and it makes them less effective.
The way I think about it is not that it's pulling them out, giving them an opportunity, but essentially, let's imagine it's getting You smoke cigarettes. The cigarette smoke is getting inside the vault. It is damaging the DNA and some of your eggs, but it's also just killing some of them inside the vault themselves.
Okay.
So that you are running out inside the vault. Ultimately, people who smoke cigarettes go into menopause years earlier than the average age.
Really?
Because they have had a destruction of the eggs inside their vault.
If I wanted to make sure that my ovarian reserve was 10 out of 10, if I was to live a perfect life in terms of what my ovarian reserve needs to be healthy, how would I live? What would my daily habits look like?
That's a great question. I love it. So what can you try to do? Because you can't control everything, but you should be able to control the factors you can. So number one, we're going to say avoid toxic behaviors. So toxic behaviors, that's going to be your cigarettes, your marijuana, cocaine. You're going to not have any alcohol. Definitely alcohol, especially in proportion, is showing an increased risk of damage. So a drink here or there, like that's not studied as well, but we know moderate to high drinking levels is associated with reduced egg quality.
What's moderate to high?
Usually considered 4 drinks a week.
4 drinks a week. So if I have 4 glasses of champagne a week.
Yep. So you have 4 glasses tonight at dinner, you've hit moderate.
That is, most people, especially in Britain.
Oh, well, here too. And honestly, with COVID especially, we saw so many people increase their drinking substantially. So you would limit the toxic behaviors. Number 2 is you're going to limit the toxins in your world that you can. Again, if you live in an area that is a high pollution area, that just might be where you live. But you should not cook in plastic, put plastic in the microwave or the dishwasher. You shouldn't use Teflon on your pans. You shouldn't touch thermal paper receipts. Like at the airport, if they print off a ticket for you or a receipt from the grocery store, that has chemicals in it itself. Takeout food. So when you order your takeout food and it comes to you and it sits in the containers that it comes in, if you're not eating it right away, or even when you do eat it, you should take it out of that container and put it in something else. Put it in glass, put it on a plate, because especially with heat, we see leaching of those toxic chemicals into the food, and then you're consuming the food. Even if it's high quality, good food, it now has absorbed chemicals from the packaging that it was in.
So microwave meals in plastic, you take the plastic and you microwave it.
Shouldn't do it.
How do we know this? Have they done research on this, or is this just...
So there is research done on it. It's always hard to study lifestyle factors in humans and when it comes to fertility, because what is the outcome? Is it the positive pregnancy test, the having the baby, the absence of getting pregnant, the irregular cycles? There's so many different variables you can look at an endpoint. A lot of the environmental chemical studies are done on animal studies, looking at some of these chemicals. But also, we can see in population-based studies, we do have now where they've done cohort studies. They take a group of people and they follow them for years, taking blood and urine samples to measure some of these chemicals and then watching what's happening with their normal behavior, no intervention. Are they getting pregnant when they're trying to, or are they not? And we see that greater exposure to these known toxic chemicals are making it harder for people to get pregnant. When it comes to other factors to try to have your healthiest vault possible, decreasing inflammation is going to be very important. So we think about inflammation, and there's 2 types. So you have acute inflammation. You cut your arm and it's going to react and heal. And that's a normal bodily process. But then you have chronic inflammation, where your body is constantly spending its energy fighting that inflammatory state, and that inflammation markers, the prostaglandins, the factors in your body that get really high, that's actually pretty toxic to our quality as well. And that can be disease states as well. So things like endometriosis or other inflammatory or autoimmune diseases.
What ways do we voluntarily increase our inflammation? Is that dietary predominantly?
Yes. So number 1 is going to be not sleeping enough. So sleep is when your body heals. Sleep is when your cells repair their damage. So you need to get 7.5 to 8 hours of sleep per night.
I heard you say in a quote, sleep is probably the number 1 thing that people don't do that does impact their reproductive hormone system.
Yes. It seems so straightforward to say it's not a pill that you take. It is not a major change of behavior. It's not missing out on something in your life. It is simply giving your body the time that it needs to heal from the normal inflammation that you're going to encounter during the day. Simply prioritizing getting enough sleep is the simplest thing somebody can do to try to improve their reproduction and how their hormones are made and interpreted.
We talked about stress earlier.
Stress impacts the brain in a similar way. There's different types of stressors very similarly. You have your acute stressor, the bear. You have the stress of everyday life. And modern world is a lot more stressful in a lot of different ways constantly. We also see that stress is so individualized. So it's not like I can say, you need to go to yoga, or you need to do acupuncture, or you need to go to therapy. I tell my patients for stress reduction, understanding that having a constantly stressed state, constantly having cortisol be made, is not going to allow your brain to interpret the other signals that are being sent. It's clouding its judgment, and it's going to think that you're not at a place to maybe support a pregnancy, and your reproductive hormones are going to show for that. What that comes down to is that you've got to modify stress in some way for you. So everybody's different, and maybe it is acupuncture, maybe it is yoga. I like to sit on the back porch in the morning hours with a cup of coffee and hear the birds. People like to go on walks, therapy, mindfulness, meditation, journaling. Everybody's different, but you deserve taking 20 minutes every day and dedicating it to something that doesn't have your iPad, your cell phone, your computer, the TV, and putting yourself in an environment where you can say, like have that feeling of release you get when your cortisol drops. That's important so that your body can then properly respond when you do have a stressful situation, and can allow you to heal, not be under a constant attack.